Welcome to the Racing to Success Minute with Nadine Lajoie. Are you nervous when you are doing a presentation in front of a group, or even when you are doing one-on-one, or when you have a new date? The best way is to prepare yourself with a template. You just put different bullet points, and you need to structure, especially in a presentation, into the template. And you practice, and practice over again. Like motorcycle racing, you cannot go in the race without practicing again and again. So be sure you apply that principle into your life and your business. You will be less nervous more and more you are practicing. So this is Nadine at nadineracing.com.
Savvy Business Radio, drawing out the best from our guests, with our host, Christina Nitchman.
Our guest today is co-founder Helen Lee of JOANY. Shares details on their free online resource where customers from all 50 states can easily research, purchase, and manage healthcare insurance plans. Get started and find the best healthcare for you and your family today at JOANY.com. Hi, Helen. Welcome to Savvy Business Radio for our Heartbeat of the World segment. How are you this evening?
I'm very well. Thank you so much for having me.
Oh, you betcha. I was so excited when Alana told me about the work that you and Christine Carrillo are doing. You started a healthcare help for people out there called JOANY. Am I saying it right?
Yes, that's correct, JOANY. Mm-hmm.
JOANY. And it's really a way for people to find out how to use their healthcare, get on there and understand it better, get a better access to it. And you do everything through your website, so they can find out all the information through your website on how to sign up and get the best insurance for their family and themselves. And we're going to go into all of that. But before we go there, I'd like to find out a little bit about your story. What brought you to even thinking to start JOANY?
Well, Christine and I have been working together for about 14 years now. And about 16 years ago, I started my career as a software engineer. And I started out at another startup that they were the pioneers really for Medicare Part D and helping Medicare individuals find the best plan for them online. So everything was done through tech and through just an online platform. Mm-hmm. And so I met Christine there, and I think that both of us, we didn't think we'd be in healthcare to that degree. But as we were in it, we realized there was just so much to it, and that there was so much confusion and frustration around it, and there was a lot to fix, right? And so, we became hooked, and we basically stayed in the industry. From that startup, Christine came in to flip it. I still was a software engineer. We got on extremely well, and one of our clients was Kaiser Permanente. From there, they had asked us to come over and help them, revamp their Medicare services for like a return of investment about $7.6 billion for their organization. So we did that for about 3 years. And then we started a consulting company called Humanize Health. And what that company did was we went into health plans to help them with all kinds of initiatives. We went in there to fix failing projects. And these weren't just your run-of-the-mill projects, but these were projects where the government was looking at them to fix right away before they shut them down for any reason. Mm-hmm. We also went in to implement books of business. Like when Obamacare came out, we worked with several health plans, both regionally and nationally, to help, actually put in processes for this new plan that was going to exist for millions and millions of people. So we were happy. We were doing it for 5 years straight. We had all kinds of clients, again, from more regional health plans to nationwide. And then we were at a dinner party, and a lot of our friends are in the entertainment business. And so typically, we're not the sexiest story out there. Talking about health insurance, and you've got people, doing these amazing creative films, and they're film directors and producers. And one of them actually came to us very frustrated and said, I need you to help me understand my health insurance. I keep, I'm being told that I've got the best insurance out there through the Screen Actors Guild, which is a group plan. Mm-hmm. But my daughter's meds and specialists aren't being covered. And so I'm having to pay $3,000 out of pocket every single month. And that seems outrageous to me. And Christine and I agreed and said, we'll take a weekend and a few hours just to see what we can find for you. As we were doing it, we realized just how cumbersome the information data was out there. You almost had to have a PhD in health insurance to understand any of this information.
Wow.
Yeah. And so we decided to put everything into an Excel sheet, and we found all the information out there. Thankfully, we had the background and subject matter expertise to actually look into what all of this meant for him, and presented him with another plan that actually cost a little bit more monthly as a premium, but that would cover his daughter's medications and specialists, and therefore he saved that year $4,000 by switching.
Well,
yeah.
That is really a significant savings. And wow, because I recall in the past, I would get so glazed over thinking about, I have to look at my healthcare plan, because every year it would roll over. I would work either as a consultant or with a number of companies, and they would have a plan that I could sign up for, but only at certain times of the year. And when it came time for that part of the year where I'm to look at healthcare plans, I would just glaze over and say, can I just pick the easiest plan, the cheapest plan, so I can be done with it?
Right.
And I'm sure
and
I'm not
that's
the only one. Yeah.
Exactly. And to be quite honest with you, everybody thinks of it that way. It's like, well, I'm not a heavy user of my health insurance, so I'm going to go with the cheapest plan. And then there are those that are saying, I've got things to cover. I'm going to assume my health insurance covers it because I've got this explanation of benefits and this booklet of things that are telling me things are covered. But if you don't actually read the fine print or understand how the jargon works, you may not actually be covered. You may be paying for a plan that doesn't cover exactly what you need for you. And so it seems to be then a complete waste.
Wow. And this will help so many people out there. I just talked to someone I work with very closely, and she ended up having to take out, I don't know if you probably heard of it, of course, because you're in the health industry, but it's this kind of healthcare credit card where if you fall short, you can get this credit card, and it's like having credit, except you can only use it for healthcare purposes. And so she had extensive stuff she needed. She needed surgery, a number of other things, and she got the card. But I thought, how sad is it? You have to take out a credit card just to pay for your medical bills, or in some cases, remortgage your house. So,
right, and the number one cost for bankruptcy in the U.S. is medical bills.
Wow.
And so it's not to be taken lightly for sure. And insurance is there for a reason, but I think what we need to really look at is what type of insurance is going to cover your needs, right? All of us have varying needs for our health, for ourselves and our families. And so when Christine and I did this sort of assessment for our friend, our film director friend, we realized like, wow, there's so much out there that people don't really yet understand because the information isn't clearly put out there. Nor is there one place that you can find all of this information succinctly so that you can actually make sense of all of it. You have to keep digging and digging and digging. And then when you find everything, it's, okay, now how does this all make sense to me? You know?
Yeah.
And so, yeah.
Until now, we have JOANY, so now it can make sense.
Yeah. And we became obsessed with it. And we wanted to really help people, first off, purchase their most optimal health insurance plan for themselves and their family. And so when we built the algorithm, we took in at least 52 data points that include, the number of doctor visits you make, the medications you take, even the finances of a health plan. And so we take all these data points to figure out what's going to be the best plan for you. But we didn't want it to end there. We found that we provided a lot of value by also extending out concierge services. And what that really means is we actually function as a health insurance broker, a web broker. So we do everything online. It's not your traditional broker where you go and see somebody in a traditional office for a few hours. You go over a few health plans. What we do is we take every single health plan in every single state. We have all of their data. So we know that we're not being biased because we have all of our data points and the algorithm to do the thinking for us at that point.
Mm-hmm.
So when we provide you with the options, they're going to be the most optimal options for you. So based on all of your personal points, like the number of doctor visits, medications, and all of that, we work a little bit backwards. We see what's covered and how much your cost will be. Let's say you take a medication that's not going to be covered by any of the health plans. We're going to check in your area through another service, like where or what is covered and how much of it is going to be out of pocket for you, so that we can get your actual cost. And then with the concierge services, we're actually helping you use your plan, right? So as a broker, brokers are actually equipped to help you throughout the year, not just to purchase your plan, but to help you use it. So they can act as almost like your power of attorney to help you either fight a bill, find a doctor, see what medications are covered, all of that information. But a lot of times, if you're a traditional broker, you don't have time for that. But since we are able to do this online through our product, we're able to also use machine learning, predictive analysis, and data analysis to help kind of back up our humans, to help people actually fight a bill, find a doctor, and do all these things that, you know, people actually need throughout the year, not just to purchase it, but to actually use it throughout the year as well.
That is fabulous. That just brings to mind for me, you guys have been working at this for quite some time now. What's your perspective on how our current system got to where it is? Because it seems like it's got so deep and kind of difficult. Is there a reason why it's gotten this difficult? Because I talked to a doctor a couple of years ago of mine who said he now spends it feels like 80% of his time filling out forms and 20% seeing clients. Do you have any ideas on how it ever got this crazy?
You know, this was the system that we saw that was broken, to be honest with you, in the very beginning. So it was there before we even entered into this industry 14 years ago.
Wow.
But I will say this. I will say that there are heavy strides in trying to fix things. There's so much to fix, but I think when we get to the nuances of, you know, different things to fix, like the relationship between health plan and, you know, provider or doctor, and then the health plan relationship with medical centers, and then you've got the doctor-patient relationship, and then the health plan patient relationship as well. There's so many things that, you know, the government is trying to do, even with the ACA. Personally, I think it was a step in the right direction. I think there wasn't a lot of information being put out there. A lot of doctors I spoke to as well, medical centers didn't understand it when it first was implemented.
Yeah.
You know, and so even from that standpoint, so when we have doctors and specialists not understanding what a new type of insurance is that people are required to have, that's a huge problem too. So there's just so much basically that we need to fix. Yeah. And it stems from way in the beginning.
Yeah, I mean, I got to the point a couple of years ago. I didn't have insurance up until this year. I finally got some, but for I think 5 years, I just decided I'm just going to have a little money on the side, and if something comes up, I'll go, because I wasn't going to the doctor very much anyway, except for maybe a physical. And I only did the physical because I had insurance, so I said, I'll do my physical. But I don't know if you've heard of these around the country where you are, but here in New York, they started something called City MD, and it's kind of like an emergency kind of outside clinic, not part of a hospital, where they have dedicated doctors of all specialists on staff for you to come in and just see them at the spur of the moment for one flat fee, $125. Now that doesn't cover any tests you need, any blood tests, any, what do you call them? X-rays, that type of thing, but it covers the flat fee, at least to see the doctor. So I did that a couple of times, but where do you see people? Do you see that sort of working in the future, or do you think using insurance is a good idea for most people?
I think insurance is there for a good reason. I do think that if we don't fix this as a whole, I think that more and more doctors will start to not accept insurance, and then people will be forced to go to clinics and, or doctors that don't accept insurance at all. Yeah. And so I think I've seen the City MDs in New York too. I think they were popping up over there. Yeah. I think any access to care is a great thing. I think if we don't fix this, then the whole idea of having insurance where people are covered should something happen, God forbid something happened to you or your family members, that you won't be covered for certain things. So unless we fix this, we're gonna start to see a much bigger decline in people using their insurance because they can't. If you can't find a doctor that's going to take insurance that you trust, and then more and more medications are dropping off medication lists that are going to be covered, then there's going to be even a bigger problem for insurance altogether, and people will stop to use it.
Yeah, and that's so true. I have a friend of mine recently who had an emergency come up. And, this is the thing about emergencies. We think, we don't really need insurance. We're fine. I'm healthy. But when you get sick or something happens, like say you crash your car, you don't plan to go out that day and crash into another car and need the emergency room. We never go about deciding, I'm going to get sick this year. But people, that's my plan this year. I'm going to get sick. But my friend ended up getting sick and needing 2 blood transfusions, and they were crazy. I mean, I was surprised to see $7,000 for one packet or container of blood, and who runs around with an extra $14,000 in their bank account? Not many. So I think those are the times in which the whole idea of having insurance came about. And you're right. If we don't begin to fix the system, then, there's going to be a lot of people left in the dark and not being able to deal with situations like this. It's absolutely pertinent. What have you found as far as been the biggest surprise of people using your services? That have they come back to you and said, wow, this has like really helped me understand healthcare and my insurance? What is some of the feedback you've gotten?
They've been pretty positive for the most part. I think, going into this, Christine and I knew just by working with the health plans that they really struggled with their customer service. A lot of times they get all the phone calls coming in from all of their members, and to get to everybody on time, they're timed as well. So they need to get through everybody's questions and concerns in a pretty concise amount of time to get through them all. But when you're talking about your health and health insurance, it's frustrating and confusing. And so it's not going to be a quick few-minute call typically. It's going to be a much longer call. And for the person on the other end, on the customer service end, to understand what the member or customer needs, it's going to take some time as well. And so we knew that in the health insurance industry, customer service just was non-existent. And so for us, it was really important to back our customer experience individuals with tech, machine learning, and data to be able to quickly answer people's needs. And so when we're able to take the time to listen to people's frustrations and, why did my health insurance plan bill me for this when it should be covered? And when we come back with, you're right, let's help you fight this, and we take the time to fight it with you or for you, it's something that hasn't been done before because it's hard, typically it's very hard. And so the feedback that we've gotten is that they truly love that we're actually taking the time to, help solve their problems, find them doctors in network or sometimes out of network with good ratings, and finding them medications at different pharmacies that will be slightly cheaper out of pocket. So having that type of custom care, and we've been called like having white glove service, has been, I think, a game changer.
Yes. I know a lot of people who would just totally love this service because I've heard them talk about how frustrated they are at healthcare. A lot of people we deal with here at Savvy are business owners, but I'm sure a lot of people you deal with are business owners maybe, and also employees. Is there any difference between working on your site, looking as an entrepreneur as opposed to a employee somewhere or an owner of a company? Is there a difference with using the site if you're working in any of those capacities?
I think typically right now what we do is we help the individuals and families because they are the most underserved. And we definitely have helped other founders of startups, other entrepreneurs, or small business owners implement health insurance plans for their company as well. And that's a little bit of a different process because it's different when you're thinking about you as an organization versus you and your family. And so on our website, we do currently have a different sort of flow for our, business owners or startup founders, entrepreneurs who are looking to have a group plan that's going to give them like tax benefits for their company, but also providing their employees with health insurance. So it's a little bit of a different flow, but in terms of like the concierge service, that's still there because it's health insurance. It's not any better on the individual end versus employer, and it's still going to be very confusing. So, we always allocate to individuals to be there to help for sure.
Yeah. Yeah. And what have you found because I've heard from some of my older, either clients I work with as a consultant or past guests we've had on, that some of our audience is rather on the older side of things, in their 60s or 50s. And if you have to switch healthcare plans at that stage of the game, is it a little harder, say, if you have a pre-existing disorder? Do most insurance companies not cover that sort of thing? How does it work if you're an older consumer?
If you're an older consumer, right before you're about to get into Medicare, because Medicare is for the ages of 65 and older, again, through the exchange or the ACA, the health insurance plans, they are not allowed to ask about pre-existing conditions, so they will not be discriminated against.
Oh, cool.
And so that's still definitely part of, the system now. And they won't be asked for it unless the health insurance mandate changes, where then the health insurance plans will then be able to ask about medical history and, deny somebody their care based off of that. But right now there isn't that.
That's great. And if you if you're an older individual and say you come in, they don't ask you if you have any pre-existing disorders, but say you've been out of the healthcare system for a while, is it a while to get taken to be seen, or do you just get picked up immediately? I know for the corporation I'm consulting with, I was able to, the day you get the insurance and pay for it, I'm able to use it. Is it different for every plan, or how does it work usually?
Usually you have until the 15th of every month to be able to sign up for the next month. So if we are in the month of October, so by October 15th, you submit your application and the health insurance plan says approved based off of, because right now we are in what we call special enrollment period. And that just means it's outside of open enrollment period. Open enrollment is the time from, I think this year they're saying it's November 1st through December 15th.
Okay.
In some states it fluctuates. So it's typically 3 months long, but for the year 2018, they decided to cut it down by half, which is awful. Whole nother topic. But if they were to come in during open enrollment, all you do is submit your application and you're in, and you get health insurance by the next month. During special enrollment period, you just have to prove or let the health plan know why you haven't had insurance or why you're signing up for their insurance now. Yeah. And their reasons could be, I just moved from Florida to California or state to state.
Yeah.
I just got married. I just got out of a job. So there are life events that qualify you to be able to still sign up for health insurance. So if you were to enter in by October 15th, by November 1st, you would have your health insurance plan and it would be in effect.
Wow. You have just helped out a bunch of friends of mine who've asked me recently about this subject. So I'm going to tell them to listen to this show ASAP.
Yeah, great. Thank you.
Well, I am so blessed you came to share this today. This is such a great topic. I know you're going to relieve so many people out there who are stressed about healthcare. And we're about to enter into the new year when a lot of people get the flu and sick and their kids are getting sick. And so let everyone know where they can find out more, get signed up today and find out more about how they can better use their healthcare system.
Absolutely. You can visit us at www.joany.com. That's JOANY.com.
That is fabulous. Well, Helen, I have to thank you again for your tremendous wisdom today. And thank you both, Christina, and you, Christine, and you. I was like, it's Christina. I'm Christina. She's Christina. But thank both you and Christine for really getting obsessed with all of this and doing this for us so that a lot of us can breathe and sleep a lot better at night. Thank you both.
Oh, thank you so much for having us.
You betcha. Take care.
Welcome to the Racing to Success Minute with Nadine Lajoie. Are you afraid to talk with your client or make the sale, or even more when you are doing a presentation? The only stress you can get out of yourself is when you are able to connect with your client. You are able to share your story with your client, and with each story, you have a lesson. And when you get the lesson, you are trying to find a bridge, something that can relate to them, to their family, to their children, or their business. So when you are connecting more with your client, it will be easier to make the sale. That will give you more satisfaction and increase your revenue. So hopefully you get the story, the lesson, and the sale with Nadine Lajoie at nadineracing.com.
Find out about our paid sponsorship opportunities or how to become a guest. Call 732-474-7375 or email Christina@savvybusinessradio.com.